Okay, let's get started. Thank you for joining us today. This webinar is going to be called an introduction to the Gateway to Global Aging Data. And we're going to be talking about the research tool, the Gateway to Global Aging Data, which is available online. And we'll also be kind of giving you an introduction into the Health and Retirement Survey in the US and its sister surveys, which are conducted around the world. If you have any questions at any time, feel free to ask me along the way. My name is Tristan. So starting in 1992, there was a study started in the U.S. Out of the University of Michigan called the Health and Retirement Study. And this study started following people aged 51 and over, and it re-interviews them every 2 years. So it's called a longitudinal study because there are repeated interviews of the same individual. It's conducted at a household level and at an individual level. So the HRS includes both a single respondent who is 51 and older and their spouse regardless of their age. And a lot of these kind of study designs specifics around the HRS are also true for the rest of these studies called the Hrs Sister Studies. So the first one is the MHAS, the Mexican Health and Aging Study conducted in Mexico. In England, we have the ELSA. In Europe, we have the SHARE survey, and SHARE is in more than 25 European countries now, I believe, and includes Israel. In Korea, we have the Korean Longitudinal Study of Aging, or called KLOSA. In Indonesia, there's the IFLS. In Japan, there's a study called JSTAR. There's also a study which is conducted by the World Health Organization, and it's called SAGE. It includes 5 different countries. Those include China, Russia, Mexico, Ghana, South Africa, and India. The Irish Longitudinal Study on Aging is called TILDA. It's conducted in Ireland. In Costa Rica, there's a study called Corellis. In China, there's a study called Charles. There's also a study called Lassie in India, which is conducted partly by our center here at USC. And we are in the field now for the first wave, the baseline of that longitudinal study. And there's also more studies that are becoming available. So in the next couple of years, there should be data available also for Brazil, for Northern Ireland, for Scotland, and for South Africa. So there are a couple of key innovations that made the HRS a very popular survey. We just had a question, is the Canadian Longitudinal Study on Aging one of the harmonized studies? That is a great study. It is not considered one of the harmonized studies. So for all of these studies to be part of this network of studies, it means that there was a lot of time and work taken to make sure that the surveys were asked in similar ways in different countries. And the Canadian study is just considered slightly too different, although people have used it in conjunction with the HRS, but I'm not going to talk about the Canadian study here. So some of the key innovations that made the HRS very popular is that it's multidisciplinary. So there's a lot of different subject matters. It's not just a health study. It's not just an economic study or demography study. It has lots of different questions, and we'll look at all those different subjects. There's also enhanced quality of economic data. So of course there's a problem in economic data, which is that you ask someone how much is in their pension and they often don't know. So one of the things that the HRS did is they incorporated what's called unfolding bracket questions. And it's at that point when someone says, I have a pension, but I can't tell you how much is in it currently. And of course you'd like to know this as a researcher. Unfolding bracket questions then ask the respondent, well, is it more than $10,000? Is it less than $10,000 or about $10,000? And if they say it's more than $10,000, then they'll say, well, is it more, less, or about $50,000? And then they answer, and you'll often get one more question. And the idea then is you get a range of where the true value lies, so you don't have to exclude that respondent from your analysis. And this also allows for imputations, which is the assigning of values to missing values in ways that we believe won't bias your estimates. And there's also integrated biomarkers into social surveys. So while there's a lot of kind of social survey disciplines that are represented in these surveys, there's also actual biomarkers. So these include things like blood pressure. Also, blood specimens are collected. Heart rate is collected. Height, weight are often measured. Gait speed, walking, these kind of tests, which are real physical hard measures that we collect also. So some of these core content areas include demographics. That includes things like education, marital status, also health area, which includes cognition, and these includes cognitive batteries. We'll talk about this a little bit later. But also things like physical functioning, depression, diseases, health behaviors, and physical activity. Health services, so insurance, healthcare utilization, expenditures, work and employment, which includes when employed or last employed, whether on disability, whether considered retired, what are the pensions that are either on your job currently or are you getting paid out of, and the type of work that you did at the longest point in your life or are doing currently. And then, of course, there's economic questions. So this includes income, wealth, consumption in some studies also, government transfers, housing, non-financial assets, and pensions. And then there's questions around family structure and social network. So this includes information on parents, on children, on the amount of exchange happening financially and through caregiving, also the amount of contact between parents and children, and parents and grandparents, and then social participation also. So how often are people engaged in their community? So because there are so many studies which are conducted around the world, and clearly they cover quite a bit of content area, the Gateway to Global Aging Data was developed to kind of be a central repository for this network of surveys where a researcher could come and find out how to use these data sets in conjunction, how to find what's in them, and to get started on their research. So what's included in the Gateway is a library that includes all survey questions. We built flowcharts that illustrate questionnaire skip pattern. I'll talk about that if you're unfamiliar with the skip pattern. There's a search engine to locate specific survey items. We have statistics built in and interactive graphs and tables if you would like to be able to play around with the data some before downloading it for yourself. We include documentation of cross-study comparability, because of course there are differences even among this set of harmonized studies. Publications based on HRS type surveys also, if you're looking for literature search, and we provide harmonized data. So briefly, I'm going to actually go to our website. So our website is, it's g2aging.org is the website address. And this is kind of our front page. And you can see across the top here these different items that we have. So we have survey, which is the link to the survey questionnaires, documentation, concordance, which is our search, and we'll be talking throughout all these, graphing, publications, download, and help. I'll also briefly say that we have a Facebook group, which we have a lot of great users, and we actively respond to them. So if you're interested in joining our Facebook group, we'd invite you to join. And we also have a Twitter account. And we have another question. The data already have missing information imputed, or the user would have to do that. So if you're using harmonized data sets, which I just briefly mentioned, these are very clean, user-friendly data sets. These will almost always have imputed data already available for you. And we'll let you know whether that data was imputed or not and how it was imputed. Some studies provide the imputations themselves. And then in some of them, when we release the harmonized data, we provide the imputations for the study. But I think for most of the studies right now, imputed data is available. So you don't have to do that on your own. All right, so survey questionnaires. So the Gateway provides detailed information about all parts of the survey, the location of all survey items inside the interview, survey questions including question text, interviewer prompts, and answer types and choices, how the question was asked and to whom, links to microdata variables. And what I mean by microdata variable there is, so you might be looking through a questionnaire and say question 31 as a question, but where is that data stored in the data set actually? And so we have the link, so what is that variable called that stores that data? And how are those values formatted? So how is a yes formatted? How is a no formatted? Assigned research topics, keywords, and domains. That helps with a bit of easier searching. And then suggested similar survey items based on what other users have been looking at. So if we go back to the Gateway, We can find all the surveys by clicking Survey here at a glance, Surveys at a glance here at the top. You can see here, this is the link to all of the core interviews. You can see their studies here across this top, starting with the HRS in the United States. And then HRS started in 1992, and you can see we currently have studies running from 1992 to 2014, based on what data is currently available. This chart is also helpful because you'll notice that while the HRS started in 1992, MHAS, the Mexican study, started in 2000, whereas TILDA, the Irish study, started in 2001. So not all the studies begin at the same time. So depending on if you're wanting to look at this data longitudinally, it's good to get an idea of how many interviews were conducted, how many waves, they're often called in a longitudinal survey, have been conducted. Also, if you click on the Study Overview tab at the top left here, you can see some more information about the surveys that might differ. So for instance, I mentioned that the HRS started for people who were 51 and older. So that's not true in all studies. So for instance, for the Korean study and the Chinese study and the Indian study, they start interviewing people at age 45 and older. So these are differences that are important to keep in mind. We also highlight whether one person was interviewed who was age eligible in that household, or everyone who was age eligible in that household was interviewed. Also whether a spouse was included, only if age eligible, or what if you have a spouse who who is in their 30s or 40s, were they interviewed also? So these are minute differences in how the survey is designed, but they can have large impacts. You can also see here we have survey methods. So some surveys can be conducted, of course, in person. Usually they're conducted in person. But there's also some studies have a self-completion portion, which is something that's left behind or sent beforehand to the respondent that they fill out by themselves. This is a way that sometimes surveys ask more confidential items that someone might not want to admit to a stranger who is interviewing them. Whether this sample was refreshed. So of course, if you have 12 waves, longitudinal waves, you're going to be losing people along the way. So often some studies will refresh their sample. And then we have some information about sample size and blood-based biomarkers. But let's go back to our core interview. And let's just go into, let's say we're interested in the European study, so that's SHARE. We can go into SHARE Wave 2, which was conducted in 2006, so their first follow-up. The first thing you will see here is all the survey modules. And the survey modules are usually grouped by topic. So of course you see the first one, we have 2 cover screen modules, which get an idea of the household and the respondents in the household. And then demographics, physical health, behavioral risk. And let's go into behavioral risk. You can see here we have a skip pattern, and we'll talk about that a little bit later, but we have a skip pattern. So the first question at the start of behavioral risk is ever smoked daily. We can see information about that. We can also see more information here by clicking View Item Details. So we can see that the question text is, the following questions are about smoking and drinking alcoholic beverages. Have you ever smoked cigarettes, cigars, cigarillos, or a pipe daily for a period of at least 1 year? It's enumerated, the answer type, meaning they have choices, and the answer choices are yes and no. And in SHARE, yes is coded as a 1, and a 5 is coded as a no. The associated variable, so if you have the SHARE data set in front of you also, the answers to this question would be stored in a variable called BR001 underscore. We've assigned some topics to it in case you're looking for something like tobacco, which isn't in the text of this question, but we still want you to be able to find that. We also have concurrent items, so this is the same question at other waves of SHARE. And we have researchers were also interested in, and it looks like someone was looking at this question with self-rated reading skills. You'll also notice, of course, so SHARE is conducted in many languages throughout Europe, but all the questions are in English. So this is true for all of the studies. Everything has been translated into English for this site. So if we go back to our surveys at a glance, you can also see here we have the self-completion questionnaires. So these link you to the PDFs that someone would fill out in these different ones. You can see ELSA has a health self-completion and a work self-completion. HRS has a psychosocial self-completion. and a couple other type of surveys. But the core interview are these main surveys which are conducted. So let's briefly, we'll look back at flowcharts, and this was that flowchart that we looked at originally from wave 2 of SHARE about behavioral risk. So many of these surveys, because they are so long, they use skip patterns as a way to not spend a lot of time asking the respondent questions which don't apply to them. So for instance, in this skip pattern, which we will come back to, they first ask, have you ever smoked? And then if the person says yes, then they get asked the question, do you smoke at the present time? It wouldn't make sense to say, have you ever smoked? And the person says no, and then you ask the respondent, well, do you smoke now? Because the answer is obviously no, which is great for the interviewer and the respondent, but what it means for you as a researcher is that in using this data for analysis is that you have to account for that skip pattern. Because if you only use the one variable, you would be missing everyone who had never started smoking. And if, for instance, if you're trying to get the percentage of people who are currently smoking, you would get an incorrect answer if you only use that one variable. So skip patterns are really important. Let's look at another skip pattern. So say we're interested in HRS, so here in the US, and we can look at wave 8, which was conducted in 2006. You can also see a flowchart for how the survey was conducted. So what are the different modules? You can see they started again with 2 cover screens, and then they moved through different ones here, going down, and we could say, for instance, we could go into the housing module here and look at the flowchart for this. The first thing you'll notice is whether the respondent type is family, right? So this is a module which is only asked if to one person in the household who is considered the family respondent. It's also not asked to people who are in nursing homes, so that's important. So these skip patterns provide a lot of information about who you'll have data for and why you might be missing data on someone. So once we have established that you're not in a nursing home and that you are the family respondent, then you get asked, did you move since the last wave or not? And then if the answer is yes, then you get asked, now I have a few questions about your home or house. Do you live on a farm or a ranch? So you can see here another skip pattern which happens actually between waves. So in this case, they're not going to re-ask someone whether you live on a farm or a ranch. Let's see, the options here are, do you live in a house or a farm or a ranch? And the answer is yes or no. If they've already interviewed this person at the same house, then this data is already known. But what I mean, again, for you as a researcher is that you might have to go back several waves for this household to find out when they first were interviewed to get that information. So skip patterns are really important. So concordance. So I've walked you through one way, which is just kind of manually clicking through a survey if you're familiar with which survey you want and which year you want and how the survey is laid out. But of course, we built a search for you. So you can identify comparable survey measures between all health and retirement surveys. You can do that using a keyword search, using top-level research domains for the HRS and all Hrs Sister Studies, and then finer research topics for harmonized data sets. So these are these clean, user-friendly harmonized data sets that we'll talk about later. And so you can this allows you to compare measures between multiple waves of one study or the same year in multiple studies. So if we go back to the website here, we can go up to our concordance. So for instance, let's say we're looking for something really simple. Like let's say that you wanted to look at height and you were interested in looking at Charles, so that's the Chinese data. You can see that we have data for Charles for 2010, 2012. Let's say you're interested in their baseline, so 2010, and you can just search for that. And what you see here is all the results that match to height that were inside of Charles. And there's a couple different kinds of height. For any of these, you could go into that question to find out more information or go into that module or that skip pattern to see who was asked which of these questions. Let's look at another example. So let's say we're using a harmonized data set. So the advantage of this, if let's say we're using harmonized ELSA and harmonized SHARE, we'll look at the year 2006. You'll notice these are the years that we have available for both of these surveys data. And then we can click any of these smaller sub-items to find the variables that are in the harmonized data sets. So for instance, we can click on number of children. and we'll search that. And you can see for the harmonized share, we'll get a variable called H2 child. We also have H2 son and H2 daughter, so we can tell the number of total living children, but also the number of living sons and living daughters. And then for the harmonized ELSA, our variables are called R3 daughter and and R3 son. So this in ELSA, it's a respondent level variable, not a household, which probably has something to do about how the question was asked in that survey. The other thing you'll notice is that these variable names relate to which wave the survey was conducted in. So we're looking at 2006, which was wave 3 of ELSA, but wave 2 of share. But it's easy to find which variables you need to collect this way for your research. And we'll look at one more example. So if you wanted to look through a particular study, so let's say we wanted to look at share in their baseline. Because we're looking at a non-harmonized study, we can't click into these kind of smaller categories, but what we can do is click some of these top-level categories. So for instance, if we're looking at cognitive questions that were asked in share, we can just search for that. What we'll get here is a list of all the questions that broadly relate to cognition based on the module for share. So it'll give you an idea of where to get started with this. We also have lots of documentation. So this includes domain-specific comparison tables for a whole host of topics and domain-specific user guides. And these user guides are really detailed and researched guides for instance, comparing health behavior between different studies. They would go through and say, how was health behavior asked in every single one of these surveys, given kind of a baseline survey year, how are they different, and how have people overcome these differences, and they can be extremely helpful. The documentation is all available using this documentation tab at the top of our page. So one thing that we might want to look at is cognition, for instance. So we can click on cognition and then click on summary table under cognition. And this will give us this cross-study comparison. So for instance, here at the beginning, we can see we have a verbal memory test. So that's a test which has two parts. One is an immediate word recall. So the interviewer or a computer reads a list of words to the respondent, and they say, how many of these words can you tell me back right now? And then there's also a portion which is called the delayed word recall. So later in the survey, the interviewer then comes back and says, hey, remember that list of words that we talked about earlier? How many of those words can you remember again? So one of the things that this chart highlights, though, is that there are some differences between different surveys. So for instance, HRS uses 10 words for the recall test, while MHAS uses 8, and CLOSA in Korea uses 3. So these differences are really important. And these summary tables, these cross-study comparison tables, are a great place to get started on seeing what is available for your topic in different studies. Also on this documentation page, we have the working series paper. So for instance, health behavior, you could click here and you could download that health behavior paper. Again, they're much more extensive than just one table which kind of summarizes things, but there's a lot of great detail in there. We also have some helpful documents, and we have our recent presentations. So this is tomorrow, where we will post the slides and the video to this webinar tomorrow. All right. One of the things that we built maybe about 2 years ago was interactive graphs and charts. So we wanted to give users an ability to kind of play around with the data before actually going through the trouble of downloading the data and dealing with things about weighting the data, subsetting the data, combining the data, which takes a decent amount of programming, even if you're using the harmonized data sets, which are these user-friendly data sets that we produce. So the graphs and tables are available by clicking on the Graphs tab on the top of our site. You can see here we have a graph for currently working for pay in the United States and China, both in 2010. And we've subset it for people 55 to 64, which we expect to kind of be working age people. And you can see they're roughly the same. We also have a table which gives you a little bit more information about whether there's a large number of missings, and it gives you standard errors also. Both the tables and the graphs can be downloaded. We just ask you to cite us. Our citation information is here at the top. So let's generate another graph. So let's compare the US, England, Japan, and Italy. And we'll look at the year 2010. And let's look at a health behavior. So let's look at ever smoking. And in this case, we won't filter by year. So we can click go. And if we scroll back up to our graph here, you can see here we get estimates for Italy, Japan, England, and the US. It looks like both England and the US have much higher rates of respondents in these age categories. So these are all 50 and over who have ever smoked, which is quite interesting. We could also look about smoking now. So it could be that there's been a change between ever smoked and smoking now. So if we click smokes now, you can see that it actually looks, it does look quite different. So in Italy, there's a much higher level of smoking, while in Japan, England, and the US, it looks fairly consistent. Of course, you could use the standard errors to see whether they're statistically different. And if you're also looking at just one country, so let's just look at Italy, and you can look at that over different subpopulations. So we could look at it over different ages or genders or races or income or wealth. So let's over gender. So if we look at smokes now over different genders, we can see that there's a really, it's a really gendered effect. So males have 24%, we would estimate 24% of males in the age group of share would smoke, while only, or will currently smoke, while only 14% of females were. One of the great things about these graphs and tables is that all the weighting and accounting for the complex survey design has already been done for you. So these are weighted estimates, so these are population estimates. You'll notice that all these graphs came up quite quick. If we do a graph which hasn't been done before, say if we looked over age, it can take a little bit longer, so it can take up to 60 seconds or a little bit longer to generate that graph. But once it's generated once, then it comes quite quickly. Let's look at a few more examples. So this is an example for a continuous variable. This is total family income, and you can see this for different age groups. So of course the distribution of family income looks different at different ages, which we would expect as people move more from earnings, work-based income into older age groups to a more maybe retirement or pension-based income. Here we have a currently working for pay. This is the United States, China, England, Japan, Sweden, and Slovenia in 2010 for 55 to 64. So we would expect currently working age individuals, and you can see a lot of cross-country differences here. And so you can get an idea of the kind of differences that you can exploit in your research. You know, if you look at Slovenia, it's less than 25% of people aged 55 to 64 are currently working versus somewhere like Sweden where more than 75% are. So what are the other effects that that has on people's health and economics? And then of course here's a table, and this shows you a bit of repeated cross-section data. So this is the value of primary residence between 2000 and 2012. Of course we could go all the way back to 1992 for the HRS, but here we're just going back to 2000. And one of the things that you can see in this graph is that looking at both the median and the mean, you can see that housing prices continued to rise until 2006. They stayed basically stagnant in 2008, and then since 2010 and 2012 they've continued to drop. So you can see the effect of the housing crisis here in the US in the HRS data. That's something that's been studied. All right, and let's talk about our publication search. So users can find publications based on health and retirement surveys around the world, which are relevant to their research focus. You can do this on our site by going to the Publications tab. I already have this pre-opened here. So for instance, you can select all publications which, for instance, use data, like we could say from IMHAS, from the Mexican study. There we are. You could also search by author too. So we could search, let's see, what's Wong A. We can also search, let's see, Crimmins here. We'll limit it to all of them. So you can search by, oh, that's title. So if you search by author, there we go. Let's go back to all author cribbing. So you can look by author. You can also search by source. You can limit it by year if you're only interested in recent publications, and select through topic. So for instance, we could look for papers that were published using cognition and the Hrs data again. So again, for any of these, we give you a direct link if it's known to the article. If it's not known, you can always use a link to Google Scholar and hopefully be able to download it that way. You can also export any of these publications. So let's say we were to click on these. You can scroll to the bottom and you can export in either TXT, CSV, or EndNote file. There's a little bit of delay. We are always kind of currently looking for what are the papers that are available, and we look maybe every 6 months. So we don't always have the most recent papers, but it's a great place to get started, in addition to, of course, looking through PubMed or Google Scholar. So everything that we've looked at so far, you don't have to be a registered user for. Everything that is available on our site is free. We're funded by the National Institute of Aging. So everything is free, but we do ask you to register for some of the uses of the data. And the things that we're going to be talking about after this are going to be available to just registered users. But luckily, registration is very simple. So in the top right corner here, if I logged out, you would just want to click register. So you can register here. All you have to provide is your first name, last name, your email address, and your institutional affiliation. And you can get registered that way. I'm going to log back in. All right, so I'm logged back in. Once you register, you will get a confirmation email with your password in that, and then you can change that password on your own. So let's talk about harmonized data files. I've mentioned these a couple of times. These are one of the things that users of our site really appreciate. So harmonized data sets are created to provide harmonized measures of HRS type surveys. And when I say harmonized, I know that I mentioned that the surveys ask things in a harmonized measure. So they tend to ask about, for instance, smoking in the same way in different countries, or they try to collect income in the same way in different countries. But of course, there are differences. People smoke different things in different countries. People have different kinds of employment opportunities in different countries. So there are differences. So these harmonized data sets kind of go the next step of explicitly creating a data set which is meant to capture those things which are most comparable between the different surveys. And the basis for harmonized data sets, we use the RAND HRS. And if you're not familiar with the RAND HRS, it's a version of the HRS data, which is cleaned and made very user-friendly by the RAND Corporation. And it's the primary way that people use HRS data because it's so user-friendly. Some of the hallmarks of the RAND HRS is that it's combined all waves, so each individual is one record, and then you would have have information about wave 1, wave 2, wave 3, wave 4, wave 5, each in that one record. And they do this through a variable naming convention. So for instance, a variable like R1 work is whether the respondent is currently working in wave 1, and then a variable like R2 work is whether the respondent is working in wave 2. We also highlight in the rest of the harmonized data sets, country-specific variable names. So for instance, a variable like R1 LBRF underscore C, this would be in the harmonized Charles, will let you know that this is the labor force status, like the labor force status that would be in the RAND HRS variable. But because we put that underscore C there, that means there's something that's very Charles specific that's happening there. So underscore C stands for Charles here. So Charles used a different response scale for labor force status, so we highlight that there. We also create spouse versions of most variables, which is helpful if you want to look at spousal or family effects, so you're not doing the spouse matching yourself. You can just look at S2 work to know whether the respondent is working in wave 2. It's therefore like very easy to identify couples who both work, who one works, who doesn't work, or who are both not working currently. Let's look at an example of harmonization and some of its benefits. So one of the things that we talked about before was skip pattern, and this is that skip pattern that we looked at before. So ever smoke cigarettes, and then if you say yes, then we get asked, do you smoke at the present time? This is one of these things that researchers have to overcome in using this data for analysis. So one of the things that we do in all harmonized variables is we try to account for the skip pattern for you. So we create a variable called R1 smoke in. So this would be for the baseline of share, that first wave in 2004. And we create a variable called whether the respondent smokes now. We assign a 0 or a no. So of course, if you have never smoked, we give you a no. If you have smoked but you don't smoke currently, we give you a no. And if you do smoke currently, we give you a yes. You'll notice that in a harmonized data set, a 0 is a no, a 1 is a yes. All harmonized data sets are consistent around their the values that we use to define them, which makes it very easy to compare things between studies. You don't have to worry about what's a yes or a no or many other things that get coded like this. So this is an example of a really simple harmonization. They also get much more complex. So for instance, this is how JSTAR, the Japanese study, asked about savings at the household level. They asked both in a self-completion survey, which was given to the respondent before, and then once the interviewer came to their house with the CAPI, they asked about it again. You'll also notice in the bottom right there, if you can see that, there's also unfolding bracket questions asking about do you have more or less than blank number of yen in savings. So we create a variable called H1 assets of checking or savings here. And we account for all of these skip patterns, and we account for the different brackets that are used by providing imputed variables. So this is a good deal of work, especially if you're just getting started with JSTAR. I also mentioned, of course, that skip patterns happen between waves. So something like a variable like this, if you're just getting started, could take you, a day or two to get programmed up, perhaps even longer. Of course, household savings is just one part of total household wealth, and you might not be interested in going through every single question that makes up total household wealth. So we've done that work for you. So the things that you're interested in, let's just say you think that wealth might have an effect, so you can control for wealth, or you could look over different wealth tertiles for your research to see if wealth is having an effect, which you might want to control for without doing all the work of going through yourself and programming all the questions related to total household wealth, which would save you something like 2 or 3 months of work. So it's a really valuable asset because, of course, there's no need for all of us to be programming exactly the same things. We also provide lots of documentation. Because we do a lot of work, we want to tell you about everything that we do. We try to stay very transparent. So each harmonized data set is accompanied by its own codebook. The codebook includes a brief overview of statistics for each variable that's included in the harmonized data set. It details variable creation and any assumptions that we made in that creation. We highlight differences between different waves of the harmonized variable, and we highlight differences between this variable and the RAND-HRS version of that variable. So we always use the RAND-HRS as the basis for comparison. And then we list all the variables that we use from the originating data set in the creation of that variable. And that's very helpful. For instance, if you want to program your variable differently than we do, that's absolutely fine. You'll know where to get started and which variables to use. We also provide all of the programs that we use to create these, so you can actually look through the code itself, or you can take part of our code and just use that. I'll also mention that harmonized data sets don't contain all of the data, all of the questions that are asked in the main survey. We really try to highlight those survey variables which are most frequently used for research and are most comparable. So it might mean that for if you have a particular interest that's not included in a harmonized data set, that you might have to program that on your own, but I would still always suggest combining that with the harmonized data set, because then you can account for all of those things that you might want to control for that are really commonly used in lots of research through the harmonized codebook. The harmonized data sets always include the original study's identifiers. You can always link back to the original study. Here's an example. This is the smoking behavior questions from the harmonized share. So you can see that we have waves 1, 2, 4, and 5 for the harmonized share. We make 2 variables smoke ever, and smoke now. And you can see that we have both respondent level and spouse level. So it's very easy in this case to identify a couple who both smoke, who only one smokes, or who neither smoke, or who have never smoked. We include some brief descriptive statistics. These are not population estimates because the weights have not been applied. It just gives you an idea of how the data is distributed inside of the data set. And we include categorical variable codes for any categorical variable. So you can see, as I mentioned, for all these variables, a 0 is a no, a 1 is a yes. And then we also use special missing codes, which are available in StataSASS and SPSS. So for instance, a .d we code as for don't know, .r for refused, and .m for some kind of other missing. And this is really helpful because it gives you more information than just saying it's missing, because maybe you think a refusal to a smoking question is different than a don't know to a smoking question, or to missing for some other reason, like perhaps they didn't get to that question in the survey. As I mentioned, there's a lot of text. So here we have the text that RW smoke ev indicates whether the respondent reports ever having smoked cigarettes, pipes, or cigars daily for a period of at least 1 year. As I mentioned, we highlight any crosswave differences, and then we highlight differences with the RAND-HRS. So here we say, in share, respondents have asked whether they've ever smoked daily for a period of at least 1 year. In the HRS, respondents are asked whether they've ever smoked, regardless of whether that smoking was daily, and not given a definitive period. So because of this difference, they're capturing something a little bit different, which is really important for us to highlight here, but also for you to know when you combine these things from different studies. So we always really try to highlight these differences so that you know any limitations that might come from using these two variables together. And then we list the share variables used, which in this case is very simple. And we can look at our more complicated variable that we talked about creating, which was the assets, household assets variable from JSTAR. You can see here we have both the savings variable, which is the value, and a flag variable. And what this flag variable does is it lets you know whether that value was imputed, or it was reported, or it's given a 0 because they don't have an asset. And in the case of JSTAR, it tells you whether that value is top-coded, because JSTAR top-codes some of their values. I just noticed, Ipio Hong, that you raised your hand. I'd be happy to unmute you if you want to ask a question. Would you like to ask a question? All right, well, if you want to ask a question, just type in the chat or the question, and I'll be happy to unmute you again. Oh, yes, yeah, go ahead and ask your question. I'm not able to hear you, but you're welcome to type it. Oh, can I still sample Canadian data to HRS? And yes, people do this, compare, yes. Can I still compare Canadian data to the HRS? And yes, people absolutely do that. I think that there's a bit of work, and you want to really make sure, because explicitly they're not exactly comparable as the other studies. You want to really make sure that what you're doing is comparing. But I think that's absolutely fair. You know, I would suggest starting with the RAND-HRS data set, and then creating those kind of similar measures for the Canadian data set to look at those differences. All right, so let's go back. I was just mentioning that JSTAR includes top-coded values. So those are highlighted here. They did that for confidentiality. But you can see that, whether a value was imputed, for instance, whether it was imputed because we had complete bracket information, meaning that we knew that it was more than, say, 10,000 yen and less than 20,000 yen, so we knew the range that it lied in, or an incomplete bracket. So maybe we just knew that it was more than 20,000 yen, and that's the only thing that we knew. Whether there was no bracket information, or whether we assigned a 0 because we know that they didn't have, it had no savings accounts, or a don't know. And in this case, a don't know means that the respondent said that they don't know whether they have a savings account, in which case ownership and the amount is imputed. Here's our how constructed text. Of course, this text is much longer because it's a more complicated variable. And then we have the JSTAR variables used. So if you wanted to go back to the JSTAR and look at what was used, you could do that. So currently here are all the harmonized data files which are produced. So I mentioned the RAND HRS, and that's distributed through the HRS. And we don't produce that, but we work with them. And then we produce the harmonized ELSA, which is the first 7 waves of ELSA. This is the English data. The harmonized SHARE, that European data set. The harmonized JSTAR for Japan. The harmonized CLOSA for Korea. The harmonized MHAS for Mexico. The harmonized Corellis for Costa Rica. The harmonized TILDA for Ireland. The harmonized Charles for China. And we have a harmonized LASSI, which incorporates the pilot data of LASSI. Of course, we will be coming out probably early next year with the baseline data for LASSI, and we'll have a harmonized version which includes that wave 1 of LASSI. And if you're wondering how do you obtain these harmonized data sets, so harmonized data files are either distributed through the gateway or by the originating study. In some cases, the data files are created by you, the user, based on code provided by the gateway. So if we go back to our website, you want to click on Download. And the first thing you can see here is that we have a grid of all the studies. And in the first row here, we have links to download the survey data. So if you want the original raw survey data, in general, it's not distributed by the gateway. The gateway is just kind of a network for accessing information about that survey. But we'll give you a link to where you go to download the survey data. All of this data is available for free to anyone doing research anywhere in the world. If you want to download the harmonized data, we have links to do that, or links to download the actual data if the study allows us to distribute it ourselves. And then in the case of SHARE and CLOSA, we say see Stata code below. And I mentioned we publish all the code that we use to create these. All the harmonized data sets are created using Stata. That's the statistical analysis package. So for instance, for the harmonized SHARE, you can download this data code, and as long as you have the original SHARE data, then you can just run this data code once and you'll have the harmonized SHARE data. And of course, if you're not interested in using Stata, if you run Stata once, you can then use a statistical package like stat transfer to be able to transfer it out of Stata into whatever statistical package that you're used to using. And then we also have links to download the harmonized codebooks as PDF, so that you can make sure to always be aware of any limitations that were used in the creating of the harmonized data sets. The harmonized codebooks also just provide a lot of general information about the survey, how it was designed, whether there were refreshment samples. There's a lot of great information in those codebooks. And again, that's all available on our downloads page. So that wraps it up for us. I will mention here we do have a help tab, and we have some frequently asked questions. So for instance, where do I download the data? Or what studies do you include? You can see that information here, and then some instructions for common tasks and links to a recent webinar video like this one that would give someone an introduction. And also, we maintain a help desk. So you can email us at any time at help@g2aging.org. And to access help at any time, we always try to get back to you within 24 hours, whether that's a question about how to get started using a data set specifically, or any other kinds of questions about whether your topic is covered. We'd be happy to help you with that. So thank you all for spending this hour with us. I'd be happy to answer any questions that anyone else has now.